Welcome to our 5 on 5. We're pleased to welcome Jeff Caulley from Asante. Jeff, how you doing today?
Doing great.
All right, so tell us, you're here to talk about all the healthcare system changes going on right now. You guys are having events. What are you telling people?
So these events, they're really geared to give people like a beginning course on what health reform means to them. So who has to get insurance and who doesn't, some of the basics like that, along with what the penalties are, and then the type of assistance that is available through the state, and then also plug people into assistance actually signing up through the process. The process isn't simple. It takes about an hour is what we're estimating, and so figuring out that all the ins and outs of your specific family situation is what we're trying to help people get plugged in with.
Okay.
Not suggesting that anybody really go this alone.
Really?
It's not that easy.
Wow. Okay.
So.
Okay. And so you've held how many events thus far, and you have more to come, correct?
So far, we've done 6, and we have 11 more lined up. Grants Pass has 3 events coming up in the next few weeks. We're going to be at SOU on Monday.
Okay.
We'll be out at Ashland High School. Still setting things up out in Cave Junction. We have an event coming up in Rogue River. We're trying to hit basically every town in Southern Oregon that we can.
Okay. And so you've had a few of them already, of course, as well. What kind of feedback are you getting from people? Are people asking a lot of questions? Are they having issues?
People are asking a lot of questions. One of the things that we talk about is that every person is different. So every family situation is different. And so the type of assistance that you might get, it's all based off of your income and how many people are in your family. And so no two people are alike. So trying to really narrow down what's really going to help them out the most in the hour and a half that we have.
Okay. And people are welcome to ask questions, and you guys kind of walk them through that process, correct?
Yep. And so we spend about the first hour of me talking them through the basics, and I usually let people ask questions throughout. Just keeps it more engaged.
Yeah, absolutely.
I wouldn't want to listen to myself for an hour, so
I'll give yourself some credit.
Yeah, so we do that, and then also have an insurance agent there who's much more knowledgeable than I am, that's able to help answer the really hard questions. I can answer the easy ones. They do the hard ones, though.
Very good. I'm glad. So. I'm sure it's good to have that person beside you.
Yeah,
right.
Great backup.
Good. All right, well, we're going to take a quick break. We'll have much more with Jeff in a moment. Stay with us. Welcome back to our 5 on 5. Again, we're here with Jeff Caulley from Asante. Jeff, of course, we're talking about the changes in the healthcare system. What is the one thing you'd like people to know out there?
So the one thing is, if you don't currently have insurance, you don't have Medicare, Oregon Health Plan, otherwise known as Medicaid, some type of insurance, you need to get insurance by at least March 31st of 2014. Otherwise, you will face a penalty tax season of 2015.
Okay.
So,
and speaking of Medicaid, is there something you want to let people know about with Medicaid?
Yeah, so Medicaid, one of the options with healthcare reform is that states could choose to expand their Medicaid. And so for years, Oregon has been basically closed to add anybody other than a pregnant woman or a child to Medicaid. Even if you qualify financially, you won't be able to get in. So the state is expanding the amount you can make to be a little bit higher, and then it's not putting any limitations on being a child or a pregnant woman. So in Oregon, it's estimated about 200,000 people will benefit from this. So that's a big number.
Yeah, all right. Okay, and so then Cover Oregon, we've been hearing a lot about websites across the country, of course, but also Cover Oregon. Where do we stand with Cover Oregon today?
So Cover Oregon still isn't working. They are diligently working on it, trying to get all the bugs worked out so that when they officially re-release it, things will be working properly. The first 2 weeks are still going to be limited to, as a citizen, you'll be able to go on, plug a few numbers in. You actually won't be able to sign up. The only people that can help you sign up would be insurance agents or what's called assisters. And so there's a lot of insurance agents out in the community, and also at Asante, La Clinic Community Health Center, we all have assisters that can help you through the process in the first few weeks.
Okay. And then I believe during the commercial break there, we were talking about roughly 55 to 60,000 people here in Southern Oregon need to be covered through this, or who are they out there?
So it's throughout Josephine and Jackson County. It's between 55 and 65,000 people that are currently uninsured, and that's about 20% of our population that have the opportunity to get signed up. It becomes a mandate, so going to be taking advantage or facing a penalty.
Okay, and Asante.org if anybody has any questions.
You got it.
Very good. Jeff, great to meet you. Thanks for coming down. Appreciate it.
Thanks.
All right, stay with us. We'll be right back.